You're live. Good morning, everybody. It is Thursday, April 16th. This is the Health and Welfare Committee. I am Vice Chair Martine LaRoque-Hulick, and our Chair, Senator Lyons, is not feeling great today. She's here with us on Zoom, and she will be chiming in as needed throughout the day, but we'll be running the show here as best we can without her presence in the room. And we're starting today with the H577 bill, which is an act relating to establishing the Vermont Prescription Drug Discount Program. And we have Charles Becker here. He is on Zoom to talk to us about the bill.
Good morning, Vice Chair Gulick. Can everyone hear me?
We can, thank you.
Perfect. So again, good morning, Vice Chair Gulick, Madam Chair at home, and members of the committee. For the record, I'm Charles Becker, staff attorney with the Office of the Healthcare Advocate. Thank you for inviting me to testify today about H577. The HCA supports H577 as passed by the House. We would support this committee moving the bill forward without further amendment, or perhaps with one very narrow adjustment I will mention near the end related to monitoring the program for its effects on pharmacy viability. As you know, H577 would allow Vermont to join ArrayRx, a multi-state prescription drug discount program. The basic idea is simple. It would give Vermonters access to another set of negotiated prescription drug prices, whether they have insurance or not. That matters because prescription drug pricing is fragmented and often irrational. A single drug will have many different prices, including a manufacturer list price, a PBM negotiated price, a pharmacy cash price, and an acquisition cost that may be dramatically lower than any of those prices. And that kind of system, access to another negotiated price, can have real value for consumers. We believe the savings potential here is real. I shared this example in House Healthcare. I take a generic medication for a chronic condition. Under my high deductible insurance plan, I would pay about $1,800 per month for that medication until I got through my deductible. Yet pharmacies can acquire that same drug for roughly $50. Through ArrayRx, the price appears to range from roughly $73 to $110, depending on the pharmacy. To me, that shows that ArrayRx can bring the consumer price much closer to the actual acquisition cost of the drug. My example is just one example, but it is consistent with broader evidence. In January, the Green Mountain Care Board submitted a prescription drug affordability report to the General Assembly. As I note in my written testimony, that report found that Vermonters could save $23.6 million on generic drugs under a cost-plus reimbursement model, representing about a 65% reduction in prices. What is cost-plus? Put simply, cost-plus means reimbursing pharmacies based on what it actually costs them to acquire the drug, plus a small margin and professional fee, rather than relying on the many opaque pricing formulas that exist today. Importantly, ArrayRx is not a cost-plus model. It's not. But from the consumer's perspective, the prices ArrayRx offers can still look much more like acquisition cost-based pricing than the prices many people see through their insurance at the cash register. And that is exactly why this bill matters. It would give uninsured Vermonters access to more affordable prices, and it would allow insured Vermonters to compare the ArrayRx price to their insurance price and choose the better option. That is why the HCA supports this bill. There are two additional points I want to make briefly. First, the House made an important improvement to the bill by clarifying that when an insured Vermonter uses a discount card to purchase a covered prescription drug, that spending must still count toward the person's deductible and annual out-of-pocket maximum. That language should absolutely remain in the bill. Without that fix, many Vermonters would face an unfair choice. They could use insurance, potentially pay much more at the pharmacy counter and get credit toward their deductible, or they could use the discount card, which bypasses their insurance, save money immediately, but get no credit toward their deductible or out-of-pocket maximum. That kind of trade-off would discourage people from using the program even when it offers the better price. The House addressed that problem in a practical way. It put the counting principle into statute and required insurers to make available a form and a process for consumers to submit eligible discount card spending for crediting. I recognize that a manual process like that may create barriers for some Vermonters. Ideally, this would happen automatically at the pharmacy counter, but current systems do not appear to support that. The House language reflects present operational realities while still moving the law in the right direction. Second, I want to acknowledge the concerns raised by the Vermont Pharmacists Association in the House. Their testimony raised legitimate questions about the broader pharmacy reimbursement environment, including ArrayRx's reimbursement methodology, and the possibility of low margin or even negative margin transactions. Those are serious issues. Financially viable independent pharmacies are also a consumer benefit, especially in rural communities, and pharmacies need adequate reimbursement. At the same time, H577 is a consumer affordability bill, and on balance, we think the consumer benefit of the bill likely outweighs the potential risk to pharmacies. But, and this is the narrow potential tweak to the language I wanted to suggest to the committee. If the committee believes an additional safeguard is needed, the HCA would support narrow language directing the treasurer to monitor the impact of Vermont's participation in ArrayRx on pharmacy viability and to end participation if losses tied to the program are demonstrated. Our main message, however, is simple. H577, as passed by the House, is a step forward for prescription drug affordability, and the Senate should preserve the House language on counting. Thank you, and I'm happy to answer any questions.
Senator Benson.
Charles, on that suggestion, did you actually send the language and the location in the bill that you would recommend that piece be added to the list of
For us.
Yeah.
I could certainly do that. I don't have the bill open before me. I know there's already maybe one or two sections in the existing language that require the treasurer to report to the legislature on the number of Vermonters and who have signed up for the program and the amount of savings that they've achieved. So it would go in that general section, and it would be in another paragraph that says, and also the treasurer should, and whatever mechanism would be available for doing so, monitor whether or not pharmacies are achieving adequate reimbursement. Certainly, there must be some way for our ArrayRx and their PBM Navitus, who are processing these claims, to determine whether or not, in aggregate, the pharmacies that are participating in the program are achieving a margin.
Here's Charles, if I could check that, just to make sure everything's going okay.
Okay.
Yeah, did you hear that? Good check. Yeah, okay. I think we got it.
Okay.
Senator Morley.
Charles, Senator Benson asked the same question I was going to ask, but the application, so say somebody has insurance and in order for it to count against their deductible, are they going to go to the treasurer's website? How do they, how do we handle that?
So my understanding of how this would work is if a consumer determines they could get a better price using ArrayRx for a covered drug. So this is there is going to need to be consumer education about how to use this program appropriately. Consumers are going to need to know that they're buying a covered drug. A drug that's covered under their plan. Otherwise, of course, that's not going to be counted. And they're also going to need to make sure that they're following their health plan's utilization management. So, for example, quantity limits. And there are ways that they could do that. For example, by asking the pharmacist to run this through my insurance first. And if the insurance returns an approved claim, that means the drug is covered under the plan and you're following the quantity limits. Then the consumer could ask the patient to the pharmacist to run the claim through ArrayRx, and if there's a better price, they could opt to use ArrayRx. Senator Gulick, did I see you have a hand up?
Because I think our next witness is gonna get into the mechanics.
Okay,
of how it
because I
works.
just don't understand.
Yeah. That'll be great to hear from Mary Blanc. So Charles, are you good at this point? Is everyone good with?
I am.
Okay.
Yeah.
Thank you so much for your testimony. Appreciate it.
Thank you.
And we have Mary Blanc, the Deputy Commissioner of Insurance and Department in the Department of Financial Regulation, to talk to us maybe a little more about the mechanics and how it's gonna work. Yeah.
And Courtney actually can give a little bit
Great.
more on that too, sort of for us. So Mary Black, Deputy Commissioner of Insurance, Department of Financial Regulation. DFR also supports the bill. Prior to it passing out the House, we worked closely with Ledge Council, Blue Cross, the HCA, and the Treasurer's Office to develop the language that as it sits right now. And so that we were all comfortable with it. The deductible issue, we all felt was important. We have a rough sketch of how it's worked in the past. When we were going through COVID, I don't know if you all remember, you could go to the pharmacy, buy a COVID test and go to your insurer and present that as a claim to get reimbursed. It's a similar sort of process, right? So Blue Cross or Cigna or MVP will have a form on their website that a consumer can use to submit the claim to their insurer, and then the insurer will look at it, make sure it's covered and reimburse them, whatever, or count that towards the deductible, whatever the case may be, or their out-of-pocket maximum, if it's a huge. We are having obviously to rely on consumers, and that's part of the work that the Treasurer's Office will need to do from an education perspective, because the biggest issue with a drug card like this is updating, right? Every Vermonter is eligible for it, but every Vermonter has to go out and say, I want this. And I know in Connecticut, the uptake has been somewhat of an issue. They've had a small uptake so far. They're already about to, I believe, engage in an educational campaign to get people used to it. When I was literally testifying on this in the House, I was just before I was texting my sister-in-law who was in Connecticut saying, do you know about this? She didn't. So that's the work that we'll have to do to make sure that Vermonters are aware of it and use it.
Connecticut added an appropriation to try to get to
Yes.
that. Yeah.
They did.
Yeah.
They also had the deductible language that they added to their bill. They actually went out without the deductible language first and then added it later. So we used that language, but they added as a model for the language we developed here. So from our perspective, every opportunity we can get Vermonters to save money is a good opportunity. And so we fully support the bill and believe that the insurance all support the bill as well. Given the nature of pharmaceutical costs and the intricacies, it's just another way to deal with those issues. To Charles's point about extra language, I know he's been sent something over and we'll take a look at it when it gets over. I would suggest that we put language in to monitor it, but the answer not necessarily to stop the program, but instead to find a solution or stop the program so that, if there's another way to deal with the pharmacist issue, we can still keep the program and deal with that issue. at the same
I
time.
agree. Yeah. That sounds good. Yeah. Any
recommendation.
Right. Yeah. Or even just the information and then the legislature will
Can figure out
that they'll figure out how to fix it. Yeah, okay, great. Any other questions from there? Or should I say Commissioner? Commissioner Blanc. Commissioner Blanc. Deputy Commissioner Blanc. Thank you.
I'm not sure you're necessarily the right person to answer this, but I'll ask the question
Okay.
anyway, is what I heard on how some of this is gonna operate is ask the pharmacist. And I know we've had some pharmacies closed in the state, like in my district, in Town of Randolph, they got one now. You go in there, there's always a line of 5 or 6 people. So if we ask the pharmacists now to run double analysis for everybody who comes up for every prescription, that's going to put a burden on the pharmacist.
Plus, it's much.
Right. Potentially, but So I'm just curious what the conversation has been with the pharmacists and how do they see this working and are they really going to be able to do this?
I know they have, they were expressed during the House testimony. I believe ArrayRx has a website or an app that you can use to look up what the drug cost would be under ArrayRx. Similar, GoodRx does the same thing. They actually have that as well. And you can look up what the cost will be. You'll know ahead of time whether or not you want to even ask that question. And then you can obviously ask the pharmacist what your insurer would cover, and do that comparison. But yes, they do, the pharmacists do have concern that they were expressing with us. You know, I agree with Charles that, those are concerns that go beyond the scope of ArrayRx. They are concerns generally with independent pharmacies in Vermont. And so not doing this program, I don't think is going to solve those problems. Those are bigger problems. No, I know, but
Understand what.
yeah, those are bigger problems, unfortunately, that we need to look to address.
There's a lot of exacerbate that
Yes.
witness and then.
Yes. Yeah.
Well, I can't remember if you heard testimony from Oregon as to how it was affecting their pharmacies. And I
Don't recall either. I know this has been highly successful in the Midwest.
Yeah.
And it was early, but I think that's highly successful. But
Maybe we can get some data on that. Okay, thank you, Deputy Commissioner, appreciate it, and we have the Director of Legislative and Government Relations from Blue Cross Blue Shield, Courtney Marcus.
Thanks very much. Mary and I were talking about who would be fastest, so if I can,
You want to win the race?
win the bet. I did, for the record, Courtney Harness, Blue Cross and Blue Shield of Vermont. I did send, Calista written testimony and also 2 letters of support from earlier in the session from Blue Cross. One that went to House Ways and Means, one that went to House Appropriations. A couple of things for the committee to be aware of, and some things that I certainly hope you see us leaning into a little bit more this session. As Vermont's only nonprofit health insurer, our mission is to make healthcare work better for all Vermonters, not just the third of Vermonters that are members of our plans. All Vermonters, and indeed, our statutory obligation is the same. So when the treasurer's team came to us with this opportunity early, and I would like to also mention that one of the few folks that came to us early with, what do you think about this idea? How can we make it better? What concerns do you have? It makes our support for a concept like this that much easier, and it allows us to be able to sit in this seat and say that we think that this is not only appropriate, but immediate relief at the point of sale that Vermonters desperately need, and they need it now. No surprise, we went through talking about Act 55 last session, and with that, a quarter of every premium dollar is spent on prescription drugs. And people often, and I'll say, the healthcare advocate has done a really nice job of talking about this in previous testimony. Vermonters sometimes have to make decisions about whether or not they will get their prescription, or buy groceries, or pay their mortgage. And I think that ArrayRx and the plan that the treasurer's team has put together here will help provide some immediate relief, honestly, for people that need it most. And we don't see any reason why anything would need to be changed. Our CEO, Beth Roberts, stood with Chair Lyons and Chair Black and the treasurer a couple of weeks ago, and voiced our support for this program and this initiative. So I don't need to go too far in depth about how great it is or how much we support it. I think I've done that already. To Senator Morley's question, folks, we have a built-in discount program into our prescription drugs, so folks don't have to show a card when they go to their pharmacist or to their pharmacy. It's automatically deducted, and so one of the perks, and we've talked about this in testimony in Senate Finance last week, one of the perks of our affiliation with Blue Cross of Michigan is significantly reduced drug costs. And so one thing about ArrayRx is, you can't double dip. So we're not necessarily overly concerned folks are going to use ArrayRx instead of our plan. We feel really good about our plan and our discount. What we do know is 2/3 of Vermonters are not covered by us, and this will be really beneficial for plan members. If I go to a pharmacy and I do use a ArrayRx card to buy my prescription drugs, folks can actually submit that directly on our website. And so we're prepared for that. We literally just talked about it in a team meeting yesterday. If this bill goes through, like we think it should, our team is ready and willing. Should folks feel like, and there may be opportunities, I'm not going to say it'll never happen. There may be opportunities where our plan members get a better deal with the ArrayRx. And in that instance, we're ready and prepared to see those claims, to put them towards deductibles and out-of-pocket maximums if the healthcare applicant suggests it. Yeah,
I think she beat you.
what's that? She beat me? I got excited. I wanted to make sure you supported it.
That's timing. I think they were pretty close.
Okay. Great.
Thank you very much.
You're welcome.
Appreciate it.
Thanks.
Thank you, of course.
Yes, it's like we have Colin Hilliard on the Zoom. He is the Associate State Director for Advocacy and Outreach at AARP. Hi, Colin.
Good morning. Can you hear me okay?
Yes, we can. Thank you.
Great. Thank you, Vice Chair Gulick and members of the committee. Apologies I couldn't join you in person this morning. My name is Colin Hilliard. I'm the Advocacy Director for AARP Vermont. On behalf of our nearly 38 million members nationwide and 110,000 members here in Vermont, we appreciate the opportunity to express our support for this bill and the benefits it will have for older Vermonters. Prescription drug prices in the U.S. are among the highest in the world, and for older adults and others on fixed incomes, increasing prescription drug prices can lead to difficult decisions and fatal outcomes. According to a recent AARP survey, 82% of adults 50 and older report taking prescription drugs regularly. Yet a 2024 report from the CDC highlights that accessing these drugs isn't always simple. About 1 in 5 older adults do not have insurance coverage for prescription drugs. And even those with the prescription drug plan, for them paying for medications can be expensive. And as a result, some older Americans are skipping doses or delaying refills to save money. Just this last year, we did our Vital Voices survey of Vermonters 45 plus and found that 84% of adults mentioned being able to afford prescription drugs was an important financial and retirement issue. That's just as important as being able to travel independently. Prescription medication doesn't work if you can't afford it, and H577 offers a way for the state to take action to lower costs for consumers. AARP Vermont strongly supports bulk purchasing because it's a smart, proven way to lower prescription drug costs. By joining forces with other states, we can amplify our negotiating power, reduce administrative waste, and create real savings that strengthen Medicaid and other health programs. These savings can help lower premiums and out-of-pockets costs for Vermonters, making essential medications more affordable and accessible for everyone. And furthermore, this program cannot come at a more critical time with the loss of the ACA premium tax credits that's impacted thousands of Vermonters ages 50 to 64. Many of these folks have become uninsured and underinsured in recent months. And so access to the free drug program discount card program would provide real financial relief. Lastly, I wanted to mention that AARP Vermont has the resources and unique ability to help ensure that the information about this program reaches older Vermonters. This is something that we've done previously in other states when programs like this have passed, specifically Connecticut. And so if passed, we plan to be a partner with the Treasurer's Office to raise awareness about the program with our members. We've learned a lot from the successes that the AARP Connecticut colleagues have had, and we look to leverage that to ensure that older Vermonters have the information they need to fully take advantage of this program. Thank you.
Thanks, Colin. Any questions from the committee? I have one, which is just that it does sound like the Connecticut program has been successful, but it also sounds like the uptake, I should say, has been pretty low. So are you able to kind of look at that example, learn from it, and do something differently in the state of Vermont so that we have a higher uptake?
So yeah, thank you for that question. I think one of the things that we learned that I've heard from our Connecticut colleagues is that, when they first passed this, it did not include the language where you could count the spending to your deductible. And so kind of having to come back a second time and re-educate folks that that was now an option was something that we heard that kind of created a lot of confusion for their members, especially older folks. So I think the fact that that is included in this in the bill here right off the bat is something that is really positive, and I think will help clear that up. I'd also add that we've heard a lot from our members across the state on this one. This has been really one of the most popular bills that we've been educating our members about this session, and so we've built kind of a list already of folks that we know that are interested in this program. One for themselves, but also letting their friends and neighbors and folks at their senior center know. We've heard from folks in over 115 towns, I believe, in all 14 counties. And so leveraging that, we know we'll be able to be a strong partner in getting the word out.
Wonderful. Thanks, Paula. I appreciate that.
Thank you.
Okay, great. Thanks a lot for being with us. Take care. We are exactly on time. It's 9:30. We are going to spin it.
Vice Chair, before you move on.
Yes.
Jen Carvey, members of the council, can I just check in and see if there's interest in having me draft a small piece of language that does what was being suggested around monitoring the effects on pharmacy?
I would like that.
Do you want the second and stop the program or just, just
Notify.
Yeah, okay. There's an annual report, so I'm just going to put it in the annual report.
Wonderful. Senator Cummings. Great, thank you.
I want to ask for some suggestions. This is that these folks cells, they kind of suggest that it's work as opposed to years ago.
Can we have suggested solutions? I'm not sure if they are the entity to come up with the solutions, because I think as you've heard, it's a more systemic problem. But
I would defer to them. I would go with just like report the data and then we would work with stakeholders to come up with some solutions. Yeah, that's great. Thanks. Okay, next is 814, which is an act relating to neurological rights and the use of artificial intelligence technology in health and human services, which is kind of a science fiction-y bill. And really interesting. You have Todd Devos here from the Director of Policy and Legislative Affairs, Attorney General's office, to talk to us about this bill. Welcome.
Thank you. For the record, Todd Devos, so your pronunciation was far more accurate.
Oh,
And Assistant Attorney General, thanks for having me here. I actually don't have a lot to say for H814. We're a member, the Attorney General's office is a member of the existing AI Council, Advisory Council, and I think that's part of the reason as 814 was originally drafted, I think it was much more expansive. This now sort of been brought down to adding a couple members to the AI Council and expanding its charter. So I'm happy to answer questions about the AI Council. From our perspective, we obviously have in our Consumer Protection Division focus on the real desire to see enhanced data privacy, AI controls to protect among consumers. It is the forefront of a lot of consumer protection. We see AI as a major danger to the scam world, and the confluence of both data privacy and AI really allowing scammers not just to kind of send you that phishing email that we used to get years ago, the Nigerian prince or whatever it was, but really having granular detail about people, so that those scam emails, those scam contacts start looking a lot more real. That's not the spin, but that's kind of our angle on it. We sit on the council in part for that consumer protection lens, in part because of our expertise in engagement with data privacy and AI. And again, I would defer to ADS really on kind of how the council operates. It's really an internal, or it has been an internal to state government and policy shaping body. This bill would appear to kind of stand from there. We don't have policy position on that. But
Right. My sense is that sections 1 through 4 are more the purview of this committee, and that section 3 really should go down to institutions and what's their full name now? Institutions and how you do something. It's, yeah.
Institutions.
Oh, really? Okay, well, they're dealing with
Oh,
technology.
no, that's
so-
right. We did take on.
Yeah.
Technology.
Yes.
Yes.
Title was, it's.
That's what you do in a 2-year budget, there's no balance.
Okay.
Okay.
So we'll probably send it down the hall. So you're not necessarily commenting on sections 1 and 4, which is more sort of a health bigger aspect.
It's not core to our work. Obviously, these are great principles and policy decisions for this one.
Okay. Fantastic. Well, thank you. Oh, sorry.
No,
So
I
you're
just,
going
I just,
to-
are you seeing any AI issues right now are issues being brought to the Attorney General's office with AI?
That's a good question. I think sometimes it's hard to know if AI is in the background of the complaint or not. I think there's a lot of AI, as I said, being used in the scam fraud world, but I'm not aware. We have brought certain pieces of litigation against the companies that use AI in a way that we think is fraudulent and deceptive. I think that's a little different than your question, which is like, are people using AI to perpetrate fraud?
Correct.
Just
Just didn't know if you've seen any cases yet or.
I mean, again, we're bringing them against sort of some of these big companies that are using AI in a way that we think is both harmful to their consumers and contrary to our law. That said, I'm not sure we're getting, and I'm happy to check with the consumer assistance program to hear kind of what's coming in from that side. I think that the real role of that is going to be these scammers just, you know, being far more surgical and far more credible looking in what comes across to you, right? In that text that suddenly uses your first name and checks in on your hometown, right?
Your dog, that's what I would see. Yeah, like, it's weird.
What you bought at the drugstore, and the data, and this, not your committee's work, but the data is, that data privacy is a real piece of this because a lot of the data packages that relate to all of us are out there.
Who's in your story this week about a gentleman who invested with this woman online and, you know, supposedly made $7 million. His son is getting very suspicious and says, you need to get out of here. And he lost his life savings, but they're not even sure the woman was a real person. Then his son found several pictures of her on different places on the net. They think she may well be a bot. She's not.
You're gonna be busy over
not to be too sci-fi about it, but that's a static image, right? It's just a picture.
No, she was moving and talking.
See that, I do think that is a big part of the future too, is as that AI starts getting, the video chat.
what I mean.
Yeah. And I think AI has another side to it, which is some of those tools are going to be available for detection and information. It is the next, I think this body is going to be addressing that. I just have to believe on a session or two or biennium or two, because we got to think, I don't think candidly, I don't think the feds are going to jump in on it as much as the states are going to want to, and we're closer to the ground in terms of what's happening to our
Bill on synthetic images, which is what they're.
Yeah.
AI.
With mental health treatment that we just did, you can't use it. You can, teenagers, you can get on, you're talking to an AI created image. You think you're talking to a real person who is, and it's a machine. And it may or may not give you good information. information. I did put something into Google Lens and they didn't recognize it. It said to me, it said, if you find out what it is, please let us know.
Their challenge. And I completely agree, and I hope we get to a place where we can focus on how to protect the lives. That space is incredible technology. We all recognize that's the actual incredible benefits and use. This outside, as with any technology outside.
Very much.
Thank you all. Appreciate the time.
I know. Jessica, did you want to say anything or?
I've already testified on this one, so start holding.
Yeah, I think the general sense right now is that 1, 2, and sections 1, 2, and 4 are within our purview, and 3, which is the board, should go down to institutions, the advisory council, sorry. So, just because that's what they are doing down there now. So, but it's not on our agenda today to talk about sections 1, 2, and 4. So I don't know if we should do that or not. Senator Lyons, if you're listening, do you want to weigh in on that?
No, I think if there's time, I think it's a great idea to have a conversation about the bill and those sections. Yeah, no, if they're, I think it's a good discussion when you think about what we're potentially putting into statute about human rights, really. And what is it that we're protecting? Yeah, I would definitely discuss this.
Thank you. We can do that. Jessica, did you talk about sections 1, 2, and 4?
I did.
Do you feel like coming back up to the table and giving us a reminder?
Sure.
And just like maybe telling us what 1, 2, and 4 do?
I was gonna say, I might defer to legislative. Okay, do you want to hear from legislative council first?
Okay. That would be fine. Check 7. Sure. It seems like it's been at least a week since we did this. Yeah.
I guess for me, as I look at the bill overall, the key is ensuring that we have guardrails so that when decisions are made, they're made by human beings. One, and they're not being made by computer enhanced
Right.
data. So,
This bill doesn't do that. That's 816. This is 814, which is the neurological rights. A little bit different.
oh, that is 816. Thanks.
Yeah, that's.
I wrote it down on my 814, but that's a big concern for me.
Yes, definitely.
Oh, but
Go ahead.
So, yeah, okay, no, let Jen go through a little bit. And then we can have a discussion.
One thing I had written down when we were taking notes was that we might need to define the terms generative artificial intelligence.
So Jen Carvey, Office of Legislative Counsel, I think some of these are much bigger conversations, that maybe, I wasn't here when you took testimony. I think, have you heard from the Agency of Digital Services on this bill?
That's what I recall.
So I think that's going to be critical to your understanding of what's in it, what's emerging, how it affects state government, which is their purview for the advisory council, and the extent to which you need to create definitions or, I think one of the things that all of the attorneys working on issues relating to artificial intelligence and building have been trying to do is ensure that any definitions that come out are consistent across all contexts. So that even as you drill in and regulate at a more sector-based level, we're not using conflicting or inconsistent definitions of some of these terms. And so I'm certainly not in any position to help you come up with a definition of generative AI. And I don't do that without some expert guidance, which may start with the agency.
Well, and again, maybe down the fall that would be there.
It may be, I know it's coming up a lot in the data privacy context in the Commerce and Economic Development Committees. So I think there, the issues are moving a lot. This bill did not go to any committee other than House Healthcare and House.
In my notes today, this is the first in the country of this kind of bill.
I think for the neurological rights, it may be.
And
So maybe it makes sense to just remind us of what is in this bill. And I think you all have it, so I'm going to assume it seems like extra effort to go on and look up. So I'm just going to remind you that this bill starts out with legislative intent around, protecting human rights using artificial intelligence in a way that is beneficial and minimizes risks, promoting ethical and responsible use, preventing harm, and improving the experience for all players in the system, and improving healthcare. Section 2 is neurological rights. It recognizes individual rights around mental and neural data privacy, freedom of thought, non-discrimination. In neurotechnologies, the ability to change an individual's decision about the use of neurotechnologies, protections from neurotechnological interventions of the mind and unauthorized access to or manipulation of your brain activity, and protection from unauthorized neurotechnological alterations in mental functions. There is no enforcement mechanism in here, so these are sort of aspirational rights at this point, as opposed to actionable rights.
Where would it go? Would it go into statute, and if so, where?
That it is supposed to be codified, not the intent piece, that is was the intent
Oh,
of
an
course, of the
18th,
bill as
okay.
introduced, but yes, this would establish a chapter with really just one section in it for now, but the potential for more. This was a much broader bill as introduced in the House. A lot of the language came out and went into the directives for a report from the AI Advisory Council. So that's, some of this is reflecting what was in the bill as introduced. It started out with the neurological rights and then created a lot more provisions around what that looks like and enforcement. That's not what came to you. Section 3 is the Artificial Intelligence Advisory Council and changing some membership and appointing authorities there, including adding some members with experience in healthcare, public education, public finance, and then and extending the lifetime of the AI Advisory Council, which is currently set to expire at the end of June next year, 2027. This would extend that until mid-June 2030. And then Section 4 is directing the Advisory Council in coordination with the Director of the Division of Artificial Intelligence, I believe is involved in the council, and in consultation with interested stakeholders to look at guidelines from national and professional organizations regarding the use of artificial intelligence in healthcare, human services, education, public participation, and public finance, research existing and potential uses of AI in public participation processes and public finance, and create opportunities for public education and engagement in development of artificial intelligence policy, and then to report back to the General Assembly in January of next year with recommendations for any additional statutory changes needed to further the purposes of this act. At this point, purposes of this act are somewhat narrow, including protections for protections for neurological rights, protections related to neurotechnologies, and proposed definitions for relevant terminology. So that's one of the pieces about coming up with definitions and having that be done through this work. Guidance on the use of generative artificial intelligence by regulated professions and regulating the use of artificial and augmented intelligence in health insurance utilization review processes. Summarizing additional ways the government can promote ethical and responsible use of AI in health and human services and education. proposing pilot projects that improve public engagement in public finance using ethical and responsible AI technology, and identifying any reasons to further extend or remove the sunset on the AI Advisory Council. That is what is the.
Okay, awesome. I'll speak with Senator Lyons, but I do think it should go down the hall. I think they need to sort out the definition of artificial intelligence, generative versus augmented versus artificial. And I also think they need to work on the membership on the council, but that's.
Okay, and I think you're asking the council to look at definitions.
Yeah.
So you may want to have that committee weigh in on asking the council. But again, you may want to hear from the Agency of Digital Services.
Yeah.
In here, because they do have a couple of individuals whose focus is artificial intelligence in state government.
Just to add, I mean, what I see is this is about, and there's probably questions we don't know what to ask yet.
Right.
And so I look at this bill, maybe restructure it and set it up very similar to what we did with the internationally trained divisions, where you have a process here, but we're also charging, and it's in there a little bit for this commission that's being set to really look at over the next year what's going on in other states. Is this adequate? Isn't it adequate? What should be added or changed? Come back next year with kind of like recommendations for any changes, because I think, and just me, this is such an evolving territory that for us to think that we're going to sit down here in the next couple hours and have it all probably isn't going to happen.
Yeah, it is evolving, but we also know that countries like Chile have like enshrined it in their constitution that like your neurological data is yours, doesn't belong to
Right. And I'm saying we should protect it.
Yeah,
I'm just saying it gives us a way of also providing more information and more analysis, like charging this commission with that task. And come back to us in another year with, just like we did in the international.
Yeah.
Documents, kind of same approach that makes sense upon.
So are you suggesting language change to section?
Well, I don't know, I guess I want to go back and look at what charge is, see whether or not we think that should strengthen.
Yeah. We can look at, well, I think you've got other things on your calendar this morning, but,
We have time, because we've got our appointments.
okay, well, I have to be upstairs at 10.
Okay.
So I don't, I have a few.
But we had laid out in the East for the internationally trained doctors, specific places that they needed to check. I don't even know
The
what
difference is
those are.
that other states are doing that and other states have done this, that.
Correct.
We can, I agree.
But if we look at other states and see where they are in this process, or is there other countries that have
It's a little
actively tackled
Part of
this?
Spain is doing it. in Northern nations.
One thing that you said, Senator, that I like is, I think it sounds like to me the commission or whatever is going to look at some definitions, because there's some things in that. I think in statute, artificial intelligence is defined.
It not, but, a related term is defined.
Related.
Yes.
So
Yes,
like
yeah.
one that just, I look at it, and
And
I
it is
don't,
defined for a particular, for a particular context, I think, in setting up the division of artificial intelligence.
but being consistent, like you said, is gonna be very critical, but
Yes.
I just struggle with augmented intelligence. I don't know what that means, Jen.
I want to give you like Google definition, that's the best I can.
Because if you're gonna put
uh,
somebody's gonna work on these definitions, like. So they're gonna change about. What is artificial intelligence? What is augmented intelligence?
So again, I would encourage you to hear from
ABS.
the Agency of Digital Services.
Yeah,
Listening.
so.
Yeah, I agree. Yeah, okay.
This really is
Their purview. and
their purview expertise.
Yeah.
And they're going to give you much better information than I can. So under current law, there's a definition of artificial intelligence systems, and it's specifically for use in the chapter on the Division of Artificial Intelligence in the Agency of Digital Services. So here is the definition. As used in this chapter, you can see the chapter is Division of Artificial Intelligence. We're in Title III, so we're in the executive branch. Artificial intelligence systems means systems capable of perceiving an environment through data acquisition and then processing and interpreting the derived information to take an action or actions or to imitate intelligent behavior given a specific goal. An artificial intelligence system can also learn and adapt its behavior by analyzing how the environment is affected by prior actions. I think you also may have a definition in the bill you're working on with KE H816. So that may provide a definition of artificial intelligence. There are a couple of different bills moving in different paths right now on artificial intelligence. So the attorneys are keeping in touch. But as far as so speaking of, here's where also the AI Council statute. So that's the definition. That there's this Division of Artificial Intelligence. Its charge is to review all aspects of artificial intelligence systems developed, employed, or procured in state government. It's administered by the Director of Artificial Intelligence. Talks about its powers and duties. It has an annual report that includes the extent of the use of AI systems by state government and any short or long-term actions needed to optimize that usage or mitigate their risks. Impact of using AI systems in state government on the liberty, finances, livelihood, and privacy interests of Vermont residents. Any necessary policies to protect the privacy and interests of Vermonters from the diminution caused by employment of artificial intelligence systems by state government. Ensure Vermonters are free from unfair discrimination caused or compounded by the use of AI in state government. Address the use or prohibition of systems that have not been tested for bias or been shown to contain bias, and address security and training on AI systems and anything else that the division is appropriate. So that's the division. Then we have the AI Council.
We're gonna have to.
To provide advice and counsel to the division with regard to the director with regard to the division's responsibilities. And also to engage in public outreach and education on AI. Here are all the members. You can't see them all in the bill because we've skipped over. We're not making changes in the bill to the Secretary of APS or designee, Secretary of Commerce and Community Development or designee, of Safety, ACLU.
So there's already an artificial intelligence advisory.
There is, you just the bill is making changes to it. It's not establishing it. Talks about the chair, qualifications.
Let's say there is established. Got it.
Yes.
Yeah.
And it's not underlined. Members are drawn for diverse backgrounds and to the extent possible, should have experience with artificial intelligence. The consultation, it directs the council to consult with any relevant national bodies on artificial intelligence, including the National Artificial Intelligence Advisory Committee established by, I think this is the U.S. Department of Commerce, and its authority in Vermont.
Okay. Wonderful.
And the chair has her hand up.
Oh, Chair Lyons.
There, unmuted. Yeah, so I think this was really helpful to go through the definition and then to remember what we're talking about here, which is a direct link with one individual and the individual's neurological connections. So remember, we saw the headphones and the other adapters that collect information individually, and then so how that is used to influence behavior or whatever else. The fine line for us is that some of the neurological information is critical for healthcare. And
Yeah.
so the extent to which it's used and how do we protect that for individuals. So when you think about the rights, individual neurological rights, we're talking about protecting our brains and how we're influenced by others. And in our case, it's within the healthcare environment.
Yeah.
And that's what I was talking about earlier. I was saying guidelines and guardrails here. So no, I think the bill is a good bill. It's just really difficult to get our arms around all of it. Because as you said before, things are happening so fast. So
Yeah.
anyway, that's all. I'll lower my hand.
Thank you.
Yeah.
Thank you, Jen. Sure. And let you go.
Right, it's in 816, there is a definition.
Right, so let me just put that up for a second, because I pulled it
Basically
up.
says reduce in this statute. So
Right.
Right, and that's, I mean, that's often how we do definitions, although there may come a point at some point where we want to put definitions, case terms in Title I and have them apply across.
Yeah.
Yeah.
The statute, but there is, in the bill 816 that you're working on with Katie, there are definitions of artificial intelligence and generative artificial intelligence. So. Yeah, thank you. So I believe, augmented intelligence is around sort of enhancing the individual's ability to do the functions that they are doing without acting, on its own. So I think things like so you're understanding that the recording sort of, recording as
Yeah.
transcribing is augmented. I don't know, you're gonna need,
Yeah, touch it.
I'm just kidding.
Okay, and we've got 5 minutes for you, Jessica, and then we're gonna move on to the appointments and, Jen's. This FYI.
That's Thanks. Sure. Thank you for having me back. Jessica Barnard with the Medical Society. Let's see here. My testimony should be posted back on April 9th, I think, if my date is correct on my, what I'm looking at. I will just highlight 2 of our concerns. One is around section 1, establishing the neurological rights, and the chair was starting to get at it, which is how does establishing these rights intersect with, medical use and use already regulated by HIPAA. Our understanding is what some of the advocacy organizations are really trying to get at is sort of the unregulated consumer use of or access to neurologic data, but that's unclear in the way it's drafted right now. There's no limitation on how it's drafted. Those are quite broad terms and rights they are establishing, and we have some concern about how that would intersect with, say, HIPAA and use by medical providers that's already regulated. Our recommendation, section 3, which is looking into Artificial Intelligence Council, already tasks them with reporting back regarding protections for neurological rights. So if you're talking about really kind of coming back with more robust data and information, our suggestion would be to sort of let that council do that work and really look at how other countries, how other states are starting to regulate this. And then a comment, I think you said one of the section, I think section 4, you said maybe would still be something you'd be looking at around the advisory council. Our question is right now, the charge of the council seems pretty focused on state use of AI, but some of what's being asked for in this report on, sort of the use in the medical field, social services, what are the ethical guidelines, seems to go beyond the scope, I think for good reason, beyond just state government use of AI, but other private or entities out there, like what guidance should there be for medical practices using AI or the educational system. So just a question or comment is the legislature really looking for the council to go beyond just use by state government? And if so, that may need to be addressed in the charge. I think it would be really helpful for some entity to be looking at those uses more broadly, and give us all some guidance on that. But right now, I think that would be a limitation of their existing charge.
Yeah, that's a good point.
So yeah, those were our major comments on the bill. So thanks for letting me recap. Appreciate it.
Thank you very much. Wonderful. So we will come back to that at a later date. For now, we have governor's appointments, which I don't know if Senator Lyons wants to weigh in on this, but I'm happy to read all the names that we have, and then some of them will have to come in for a hearing. And then others, I think we just call or try to connect with to see if they're willing to continue.
Yeah, I think, just look and see where folks are from. As you read their names off, somebody you might recognize who they are. And then, you can make a choice about wanting to, connect with each person. And then you'll be responsible for reporting them out on the floor. So,
I know, so Senator Lyons, is that the case even for someone like Owen Foster, who will be coming in for a hearing? That's what we did before.
so, there are people that we have in that list, I think, who we do not need to have in for another reappointment hearing.
Okay,
Rather, I think Owen falls in that category. And you
okay,
can, but the person who picks Owen should ask him if he wants to be reappointed. So I don't know who else is on the list. So someone like Owen Foster, who's chair of the board, would be an underlined name in the calendar and reported verbally on the floor
great.
when it happens.
Yeah, Senator Lyons, would you like to reach out to Owen Foster?
Sure,
Okay,
probably when I get my voice back
when you get your voice back.
and I
it's
feel
gonna
better.
come back. Someone else can do it, but it will come back.
Thank
How about Rick Hildebrandt? He is the commissioner of the Department of Health, and he's been in recently, but
you. And we told him that when he came in, you remember we said this was his interview,
right, that's right.
appointment interview.
He's done. Okay, he's done, so he's good. Jenny
Who's gonna do him? Who's gonna call him?
Rick, who's gonna call Rick? He lives in Clarendon, Vermont. Okay, Senator Benson.
All right.
Jenny Samuelson, Secretary of the Agency of Human Services. How would you like to speak with her?
I don't know that we need her in either. I mean, these are old appointments. Yeah,
Okay. Would you like someone to give her a call?
that would be good. Where does she live? Just Shelburne?
She lives in Shelburne, so she's your constituent.
Okay. If we'll see how many I get, but I'm glad to do it.
Okay, yeah. Sarah Teachout, Green Mountain Care Board. I think Ann Cummings, Senator Cummings will do that. Thank you. My constituent for 3 years. She wants to be left.
So let me ask this question. Do you want to have Sarah in for a short meeting? We haven't had, yeah, let's do that.
I would, mainly because we haven't seen her all year and we used to see her all the time, and it'd be nice to hear updates on how things are going and so, but you can still call her.
Yeah, no. Senator Cummings can still be the person, but we'll Calista, we can,
You're gonna have her in?
yeah,
For an interview?
we'll have her in.
Okay, then I don't need to call
No,
her. Okay.
you can call her from the committee room.
Okay. Sandy Hoffman, Commissioner of the Department for Children and Families.
Oh,
She lives in Essex. I guess she's my constituent.
why don't you do that? Yeah.
But will we have her in?
Question for the committee. She was in testifying recently on a couple of bills, so committee, what do you think?
I would, yeah, I would like to.
Okay, can do that.
Yeah, from Sarah. Dr. Susan Blish, member of the Board of Medical Practice.
Yeah, we don't need to have that person in, but someone should call.
Rutland. Anybody? Rutland?
Well, wait, John Morley hasn't gotten anybody yet.
So what you do is you give them a call and you say who you are, and then you just say, are you interested in continuing to serve on that board?
Right.
And then ask them a couple of questions about
So this is
whatever
twenty-five.
you want. What do you like about it? And
What's the period?
what's your background? Whatever's on there.
25, 27.
Yeah. These are late, we're late, yeah, because we admit that, and we also don't have contacted about that. Gail Paul lives in Plainfield. Public member of the Board of Medical Practice.
Oh, you got it.
Great. And Suzanne Jones, who lives in Mendon. Physician assistant member of the Board of Medical Practice. I can do
Are
that.
they all,
Yeah.
Okay, but we can't do any of these, so we'll get phone number.
Right, so we will work on getting contact information. We'll use the interwebs to figure that out. And just,
Governor's office, if they want these people confirmed, should send us.
all one, you gotta get them all.
all right, so we are gonna go offline because we are not on again until 11 o'clock with H 938, an act related to establishing the Vermont homelessness response continuum. Everyone good with that? Senator Lyons, are you good with that?
I'm very good with that.
Okay, great, thanks.
Thanks.